heavy patient-to-nurse ratio affects your day in many ways. First and foremost, it affects patient satisfaction, because when you have so many people that you're trying to take care of, you yourself do not have enough time and effort to really deliver the kind of care you would want to deliver because you're being pulled in so many directions. So that's the first person who it really affects. Second, it affects yourself. You feel like you don't give as safe of care because you don't have the time to scrutinize through all the labs and really look through everything. So it affects the patient, and it makes you uptight and nervous and kind of frantic.
Well, often in nursing we will have situations where we are understaffed. That happens quite frequently. In those situations, it doesn't go so, the flow of patient care doesn't go so well. You're rushed, which is not a good thing, because then you don't give your patients the time that they need as far as, like I said, teaching, and even if they have any concerns or if they're afraid. Like I said, I work in surgery, so people going to surgery, it's understandable that they have apprehension, and you're not able to spend enough time with them, to make them comfortable. Also, it's pretty chaotic, and things are missed. Things can be missed. You can make medication errors. You can miss things as far as if they need a treatment done. And I mean, we're only human, but those are the things that can happen if you have a poor patient-to-nurse ratio. When there's bad leadership, that also reflects on staff, and my thought on that is when there is bad leadership, then staff don't work well together. There's no teamwork. There's a lot of nitpicking and backstabbing and things that you don't want to have happen. You hope that situation doesn't exist, but it does come from the top, and when leadership doesn't know what they're doing, then it does create a lot of chaos in the workplace, and it's not a good situation.
So poor management can affect my day if I am not comfortable enough going to my manager, and whether it's reporting an incident or just coming to them with a concern I have about a certain patient or a policy that is difficult to follow or something like that. So it's important, I think, for management to be approachable, and also that they listen to your needs. A lot of times nurses being on the floor and being in kind of the front of everything, we notice things that could be done better or things that aren't working right. So just that they're approachable enough and that they really actually take into consideration what we're saying and try to take some action instead of just saying, yeah, okay, and then you never see any results.